Let's take one of the most common positions that people are unable to give up, sitting. Most people these days have to sit either because of their job or travel, so it's hard for a lot of people to give this up. If you have to maintain the seated position for a long amount of time, here's some strategies to minimize the damage that it can do to your back and neck. One thing you need to understand before I can explain this in great detail is the concept of creep. Creep is a property in the tissues of your body that allows them to bend and twist without snapping. So the discs in your back and the muscles in your back have the property of creep. What happens is, as you subject those tissues, say a muscle or a disc in your back, to a sustained load, as when you're sitting, the timer starts. And you have anywhere between 15 to 30 minutes before creep kicks in. When creep does kick in, the disc in your back starts to deform. It's like plastic, it starts to bend and lose shape. Same with the muscles. So creep is a good thing in that it keeps the tissues in your back from snapping, but it's a bad thing in that it subjects them to harmful loads and also causes pain and spasm. In addition to that, it puts you at an increased risk of injury once you get out of that position for about 15 to 20 minutes. So let's talk about sitting. If you have to sit to avoid creep kicking in, you need to break up sitting into small chunks. For most people, ideally, it would be about 15 to 20 minutes. If you can't do that, at least 30 minutes, you need to get up from your desk or stop your car or get up in the plane and just walk around. If you're in a plane, just go back to the bathroom, even if you don't need to. Go back by the restroom, stretch out, move, bend, try to offset that process of creep. If you're in a car, pull over, either at a gas station on the side of the road, get out and walk a little bit. If you're in the office, go down the hall, get a drink of water, go to the restroom, whatever you need to do. But you need to break up that seated posture every 15 to 20 minutes and no more than 30 minutes if you can. When you are seated, you do want to maintain good posture, but again, even if you're maintaining perfect posture, you don't want to do it for too long. So in the seated position, good posture is shoulders back and down, your head is over your shoulders, not extended forward. Your feet are underneath you and you're sitting on your sits bones. Those are the bones you can feel underneath your buttocks. Again though, if you have to maintain this position for an hour or two, creep is going to kick in and is going to start to damage those tissues that are being loaded right now in this position. So your strategy then, if you absolutely cannot get up, is to switch positions. And this is one of the few times when I'm going to tell you it's okay to have bad posture. If you must sit for hours on end, don't maintain good posture the entire time. Slouch a little bit for 5 to 10 minutes. Put one leg over the other. Kick your legs up on the table. Do anything to constantly switch the tissues in your back that are being loaded. So changing position is good. Getting up and moving is optimal. Let's talk about standing. If you're in a situation where you have to stand for a prolonged period of time, we're going to give you some tips that'll help. Just like with sitting though, it's ideal to move whenever you can, especially every 15 to 20 minutes, no more than 30. So if you find yourself in a situation where you must stand, number one, try to use good posture, especially in the first 15 to 20 minutes. By that I mean standing tall, chest out, shoulders back and down, head over your shoulders. Maybe a slight bend in the knee. What you want to avoid is forward leaning, which makes these muscles in your back work, and forward jutting of the neck, of the head, that makes your neck muscles work. Give those muscles a break and stack yourself upright to avoid stress and strain on the muscles. If you must stand for more than 15 or 20 minutes, change positions. Get out of that good posture for a few minutes. Lean to one side or one leg. Certainly if there's something nearby you can lean on, go for it. Shift your weight forward, back, and to the sides to try to avoid that creep process kicking in and doing damage.